Hi, Betsy Watson here today to talk about gratitude and heart health. My hypothesis is that practicing gratitude has measurable health benefits and is a useful adjunct to treatment of heart disease. Biological, psychological, and social pathways lead to improved outcomes, and gratitude practice is congruent with the needs and development of older adults. Heart disease is the #1 killer in the United States. It is a chronic disease process that develops over many years, starting with hypertension, pressuring first the blood vessels, then the left ventricle of the heart. The force of the blood causes tiny injuries to the vessels, setting up inflammation and buildup of plaque that further narrows the blood vessels, increasing stress and damage to the system. Gratitude is a perception of goodness that comes from outside of oneself. Ways to measure gratitude include the GQ6 questionnaire, the more extensive gratitude, resentment, and appreciation test, or interviews. Robert Emmons of UC Davis has studied gratitude, finding many benefits, including better sleep, well-being, helping others, optimism, and stress reduction. Some techniques for cultivating gratitude are savoring, contemplation, and journaling. Paul Mills studied patients in a critical period for intervention. They were asymptomatic but had a diagnosis of left ventricle hypertrophy. He found that more gratitude in these patients was correlated with better mood, better sleep, less fatigue, and lower levels of inflammatory biomarkers related to cardiac disease. Joshua Rash performed an interventional experiment. The participants underwent ECG cardiac tests during grateful contemplation, showing a positive physiological response with a more ordered heart rate waveform and greater physiological coherence. Cardiac coherence is thought to be the result of increased parasympathetic activation and reduced sympathetic activation. This coherence has been hypothesized to reduce stress. Huffman studied the effects of the positive states of gratitude, optimism, and positive affect. They were bidirectional with healthy behaviors. Gratitude was the most frequently cited emotion, and participants didn't particularly connect feelings of gratitude to their health behaviors, but note that this finding is by recall and self-report. Looking at pathways of the interaction between the psychosocial factor of gratitude and how it is hypothesized to lead to improved cardiac outcomes. The Rash cardiac coherence results point to a biological pathway with downregulation of the sympathetic nervous system. Mills found a biological pathway in the reduced circulating inflammatory biomarkers in the bloodstream. He also pointed to the bidirectional pathways in heart failure between depression, poor physical fitness, poor sleep, fatigue, and inflammation. Emmons wrote of the Counting Blessings trials. Among other benefits, participants helped each other more, demonstrating the social aspect of gratitude. Gratitude is a form of appraisal and operates on the cognitive portion of well-being from the person's own experience. Huffman's subjects reported no connection between their thoughts of gratitude and subsequent exercise or diet. However, Emmons' Counting Blessings subjects reported exercising more. We've learned from Sapolsky that sleep is important to cardiac health and stress management. Those effects are bidirectional, as sleep deprivation is stressful and stress disrupts sleep. Both are damaging to heart health. The developmental process of aging increases socio-emotional selectivity and positivity effect in older adults. Gratitude, with its positive appraisal and focus on the good in life, is an acceptable intervention, well suited for use by older adults. As we learned in week 5 of class about age and stress response, With age, we are more physiologically vulnerable to the stress response. Age moderates between the stress response and physiology with more reactivity and reduced efficiency of the negative feedback loop to turn the process off. For both men and women, increasing age is increasing risk factor for heart disease. These are my references. Thank you for listening.